The hand can be classified into four parts. The fingers or the digits extend from the palm of the hand, the palm, the back of the hand, and the wrist, which connects the points between the arm and the hand. The wrist allows the hand to flex, extend, and rotate. Each hand consists of roughly 27 bones, varying between people. The average hand has 5 distal phalanges, 4 intermediate phalanges, 5 proximal phalanges, 5 metacarpals, and 8 carpal bones. The dorsal part of the metacarpals forms the knuckles, where they join to the wrist. One can feel and see the metacarpals on the back of the hand through the skin. On the palm side, the metacarpals are covered with connective tissue, which assists in the contraction and extension of the fingers. Each metacarpal has a head, body, and base. The first metacarpal is the shortest and most mobile of the 5. The first metacarpal connects to the first proximal phalanx of the thumb as well as the trapezium. The longest metacarpal is the second. This metacarpal articulates with the second proximal phalanx of the second finger, trapezium, trapezoid, and capitate. The third metacarpal articulates with the third proximal phalanx of the middle finger and the capitate of the carpal. The fourth metacarpal connects to the fourth proximal phalanx of the ring finger and to bones of the carpal, capitate, and hamate. The fifth metacarpal is the thinnest and shortest of the metacarpals, articulating with the fifth proximal phalanx of the pinky finger and hamate of the carpal bone. In general, the metacarpals connect to one another laterally and medially on the sides. Metacarpals also articulate proximally with the carpals and distally to the proximal phalanges. The functions of the metacarpals support movements of the hand. In addition, metacarpals create insertion and attachment for muscles and ligaments. Metacarpal fractures represent 35% of all hand fractures. Injuries during sport activities account for roughly 12% of those fractures. Due to the active blood flow supply that metacarpals contain, the fractures heal rapidly within 6 weeks of initial injury. Of all the hand fractures, the fractures of the fifth metacarpal are the most common due to sport injuries. Patients with metacarpal injury may present pain, swelling, discoloration, limitation of movement, and deformity. Management of recovery for the fractured metacarpal includes compression, ice, and/or a splint if necessary. Medical technology has enabled doctors to create different types of prosthetics for the hand. Those that were born with limb deformities or had amputations of the hand are now able to use their prosthetic as if their hand had never been removed. With common movements that a person uses every day, the hand is one of the most important parts of the body.